Howdy, colleagues. It's Rob Franklin, the AAEP President. Just want to provide you with another update on some of the topical things that have been going on with the AAEP leadership. The first thing that you're probably familiar with is the recent problem with illicit xylazine usage. This common tranquilizer, as you may be aware of, is being mixed with some methamphetamines and other illicit drugs, and it's resulting in some major health crises in urban areas and where people are developing these massive dermatological wounds. They're going into non-Narcan responsive comas, and people are even dying. So it is a big problem. The source of the xylazine appears to be from bulk chemical agents, and there doesn't appear to be a substantial amount of diversion from veterinary supplies at this time. That has at least given a case for us as veterinarians to go to politicians who are trying to get this drug scheduled, for us to be able to say, hey, we're not the source of the problem, and so don't limit our ability to use the drug by scheduling it. The problem with the politicians right now is that there's no way for them to go after these people that are using xylazine illicitly because it's not a scheduled drug. So that's the reason they're trying to schedule it. Of course, the reason that we're trying to keep it from being scheduled is to keep our access to it and the cost of it down. And right now, the federal lawmakers appear to be sympathetic towards our position, and they are trying to create a law that specifically makes the illicit or human use of xylazine a scheduled drug, and the illicit or veterinary use of xylazine an unscheduled drug. So that's where we're working with the AVMA PAC, and we provided a position statement from the AAEP. And so those are the steps we've taken so far. Some states are going at this alone, and they are actually scheduling the drug without waiting on the feds to do anything. There's many members that are going out and working with their state representatives, going to town hall state meetings, and providing our point of view. And so we encourage all of you to do that, to participate, to provide feedback to your state politicians, to your federal politicians, to make sure that they completely understand the veterinary point of view regarding illicit and licit uses of xylazine. Another thing that I'd like to share with you is an expansion of our Members Assistant Program. Now, the Members Assistance Program is a value add that is free for all members in the United States and Canada. But what's really exciting is that now, for a low monthly fee, you can add in your entire staff to be able to receive this type of program and assistance. So if you're not familiar about Member Assistance Program, this is a great way to support practice culture in your practice. Member Assistance Programs offer access to things like legal advice, counseling, mental health experts, and even accounting experts. You see, whenever we get small problems in our lives, maybe we're dealing with debt, maybe someone on our team is dealing with a legal situation, or maybe someone's dealing with mental illness. When you don't have a plan, when you don't have an expert you can turn to, those small problems can just continue to cascade and get out of control and become major problems in our lives and in our team members' lives. The Member Assistance Program provides access to these specialists for, again, the fee for your team, and it's already included for you as members in the US and Canada. And so we can go in and we can create a plan to address these major issues in our lives and our team members' lives. So look at the Members Assistance Program, consider adding coverage for your team members in order to improve your practice culture. The last thing that I want to provide an update on is the Commission for Sustainability in Equine Practice. As you'll recall, this is the focus of everyone on your board of directors and the staff members. This is our top priority for the third year in a row now. And this is where we're trying to engage our young veterinarians, people that are considering equine practice, and those that are maybe mid-career that are experiencing some burnout. And we're trying to understand what the factors are that is contributing to a lack of veterinary professionals in the equine space, and then create toolkits, best practices, and standards that you can use to make your practice better. So again, there's 5 pillars that we came up with whenever we're dealing with this commission. The first is looking at the students and ways that we can help them. Following that up with an internship subcommittee, practice culture subcommittee, and then a compensation subcommittee and an emergency duty subcommittee. So all these subcommittees are working very hard. They're working in the background day to day, and they're exchanging information between each other, and they're reaching out to our members through webinars and Zoom meetings and written publication and infographics for your clients and a whole host of ways to begin to get information back out to members. So when this thing first started, we started by gathering data. Then we started to divide and conquer, so dividing up into these subcommittees and creating energy to act on the data that we collected. And now we're disseminating that information. And so that's where we currently sit in this 3rd year of the commission. I'm excited to hear back from so many of you that are seeing changes in the industry. You're seeing them in your own practices. You're beginning to be able to hire people that maybe it's been difficult in the past, or perhaps people are signing up and staying on a bit longer. So that is very exciting. And I do want to end with the fact that this is all of our problems and it's not anyone's fault, and assigning blame to anyone doesn't really provide any constructive energy for what we're trying to do. And really, for things to change, it all occurs with us. So nothing happens until we change, and we could be a practice owner, we could be an associate, we could be an instructor, a professor, a laboratory researcher, or an industry person. All of us have the ability to have a conversation, to do work that matters, to change our own practice culture, to change the way we interact with people. We are ultimately individually responsible for changing the numbers in equine practice. And so please encourage you, pay attention to what the commission is putting out, lean into this problem, and then make action at home where things will really begin to change when we all take that approach. So until next time, iron sharpens iron, be the best you can be, and let's continue to push on equine profession and make it the profession that we can all be proud of.